Hello, my name is Maleka Haider, and this project is titled Beyond the Medical Gaze, Lived Experiences of Women with PCOS. My research explores how individuals with Polycystic Ovary Syndrome navigate their condition within medical and social contexts that often overlook their experiences. Polycystic Ovary Syndrome, or PCOS, is typically defined in medical textbooks as a hormonal imbalance characterized by cysts on the ovaries, irregular menstruation, and fertility problems. It's estimated to affect 1 in 10 women globally, but this neat definition disguises just how messy and inconsistent the medical understanding of PCOS actually is. So rather than repeating what biomedical research already says, my study looks at what these biomedical definitions overlook, how women themselves experience, interpret, and navigate this condition in real life. My guiding question asks, how do individuals with PCOS experience and navigate their condition? This study explores how people make sense of their diagnosis within both medical and social contexts, examining how knowledge gaps, societal attitudes, and lived experiences influence their understanding of PCOS and overall well-being. My work draws on Michel Foucault's concept of the medical gaze, the idea that medicine often isolates the body from the person, as doctors fit a patient's story into a biomedical paradigm, filtering out what is deemed as irrelevant material. Feminist scholars, on the other hand, have long shown how women's health concerns are frequently dismissed or oversimplified. In this study, I use feminist and sociological lenses to reframe PCOS, not just as a biological disorder, but as a social and emotional experience shaped by systems of knowledge and power. I conducted 6 in-depth semi-structured interviews with women aged 22 to 33, all clinically diagnosed with PCOS. Interviews took place over Zoom or in person, lasting 45 to 60 minutes. I analyzed the data using thematic analysis in vivo and identified recurring ideas and patterns across transcripts. Ethical approval was obtained from the University of Calgary Conjoint Faculties Research Ethics Board. Through thematic analysis, 3 main patterns emerged from participant narratives. First, that medical uncertainty often resulted in dismissal. Second, that PCOS carried deep emotional and social consequences. And third, that these experiences pushed participants towards self-advocacy and alternative forms of knowledge. My first theme, dismissal as a response to medical uncertainty, captures 3 recurring experiences. Across interviews, participants described having their symptoms dismissed as normal, being given medications like birth control or metformin with little explanation, or even being blamed for symptoms due to weight. These experiences revealed how providers lacking knowledge and solutions often shifted the burden onto patients when they had no clear answers. Ultimately, this pattern reflects how medical uncertainty shapes dismissive care and leaves patients without meaningful support. My second theme, mental health and social struggles, explores how symptoms of PCOS were often misunderstood or stigmatized, leading to emotional isolation. Participants described how fatigue, mood changes, or lack of energy were seen as laziness rather than symptoms of a hormonal condition. This misunderstanding by both doctors and others often minimized their experience and reinforced feelings of shame and loneliness. These accounts show that PCOS is not just a physical condition, but one that profoundly affects mental health, self-perception, and belonging. My third theme, self-advocacy as resistance, explores how participants responded to repeated dismissal by taking ownership of their care. Many turned to online communities, social media, and independent research to fill the gaps left by healthcare providers, even describing having to fight for information that should have been easily accessible, turning frustration into action. These themes show how women transform dismissal into agency, creating their own pathways to knowledge and care when the system failed to provide for them. To move forward, we need to look beyond biomedicine as the only framework for understanding PCOS. Medical definitions alone can't capture the complexity of how the condition is lived and felt. Meaningful progress begins with patient-centered care that listens and responds to lived experience. It also requires greater social and cultural awareness, recognizing how stigma, identity, and access to care shape the everyday reality of living with the condition. By strengthening education and research, we can build more informed and compassionate models of care, seeing PCOS not simply as a medical issue, but as a human experience that deserves empathy, understanding, and systemic change. I'd like to thank my supervisor, Dr. Ariel Ducey, for her guidance throughout this project, and the participants who generously shared their experiences and insight.